Thank you. Thank you, Ryan. Thank you, Elaine. Thank you, Heritage Foundation.
Could we get the PowerPoint back up?
Okay, thank you. I'd like to start with some scenarios first, and you've heard one of them already. A 17-year-old boy has the penis of a 9-year-old. How does that happen? Girls in the United States as young as 13 and 14 years old are having mastectomies of completely healthy breasts. Why is this happening? NIH-funded research is examining the effects of kids as young as age 8 receiving injections for gender transition. Who is allowing this? Step back, talk about some definitions. What is gender dysphoria? It's a mismatch between a person's physical sex and their mind's perception of that sex. Leads to significant distress and clinically impairment of functioning lasting at least 6 months. And this is a real condition, and these kids, of course, deserve all the care and attention and love in the world. But we're concerned about medicalization. Most of these kids, as Ryan said, will actually grow out of this condition either through watching and waiting or help from a therapist or psychologist. There's a newer phenomenon of adolescents, particularly teenage girls and some boys who are suddenly developing this condition. Dr. Lisa Littman did an excellent publication about this, and there seems to be involvement. Many of them have neuropsychiatric conditions or, say, autism, social media and YouTube and things like that. Binge watching YouTube videos of transitioners seem to be playing a role. Contagion seems to be playing a role. The opposite of allowing kids to grow out of this or helping them with therapists is gender affirmative therapy, and Elaine went through that, but basically a social transition, puberty blockers, which I'll talk about, cross-sex hormones, or opposite-sex hormones, and then surgical modifications. What is all this predicated on? Something called gender identity. This was defined in a court case as a person's core internal sense of their own gender. What's interesting I found in this case is they said that this gender identity is the primary factor in determining a person's sex. This is an ongoing case, and not biology. That's incorrect. Colleagues and myself wrote a letter to our main endocrine society's journal with concerns about this therapy, but also the diagnosis. Let's think about it for a minute. If your child or someone you knew had cancer, would you want a pathology result? Would you want imaging to prove the cancer before you give harmful chemotherapeutics? How about this? How about for the so-called transgender child, the gender identity? Can you find it in a blood test? Can you do testings of genetics, or can you do a brain image and find the gender identity in there? You cannot. There is no objective test to diagnose this. Yet we're giving very harmful therapies on the basis of no objective diagnosis. This might seem obvious if you can see the slide. There are only 2 sexes. Certain science publications want to make you think there's more or that it's a spectrum. You can prove this to yourself through a thought experiment. Start with yourself as a fertilized ovum and work your way backwards. You'll find a sperm coming from a male and an egg coming from a female, and this is true of 100% of cases, now and forever in the past and forevermore. Sex is identified at birth. Nobody assigns it. Doctors don't arbitrarily assign this person to be a boy and this person to be a girl, and we all know how to identify it. I would say ask someone's grandmother who doesn't read these science periodicals, and they'll tell you exactly how to identify boys from girls. Now, we divide sexual development into stages we call Tanner stages. And you see at the top there, Tanner stage 1, the male is on the left, female on the right. 1 is undeveloped before puberty. 5 is full adult development. 2 is the beginnings of puberty. So a pediatrician could recognize this through beginnings of pubic hair. As you can see, beginning to lengthen the penis, testicles, breast development in females. Later on, around stage 4 is where fertility is established. First period in females, sperm development, usually 4, sometimes 3. But those are important times to keep in mind. What governs this whole system is the endocrine system. There's a small gland that's at the top there called the pituitary gland, hangs off the brain, produces hormones, signaling hormones. You can see LH, FSH. These act on the gonads. So in the male, LH will act on the testicle to produce testosterone. You can see illustrated there. And in the female, LH will act on the ovaries to make estrogen. And it's these hormones which take the person through the stages of development and then are available in adulthood. Now, there are medical conditions where this process is interrupted. We call it hypogonadotropic hypogonadism. This is something an endocrinologist would diagnose and treat. There are also hormones which can cause this to happen. Medications like Lupron you may have heard of. This is used for prostate cancer. It works in this way to stop the pituitary from making this LH and lowering testosterone and preventing growth and spread of prostate cancer. It's also used in early puberty. There's something called precocious puberty. This might start at, say, at age 4. And so doctors can use this type of medication to delay it to a more appropriate age, like age 10. What about using this medication for stopping normal puberty, say at 12 or 8? This is an off-label, untested, experimental use. It hasn't been through any FDA approval process. It's what I would call a chemical conversion therapy. You can see here illustrated our Endocrine Society is recommending for these kids to stop puberty at 10 or stage 2, which is just the very beginnings of puberty. And you can see they will not proceed through the other steps of puberty. This is what leads to infertility because they don't establish fertility. Other problems of sexual dysfunction. On the I Am Jazz show, Jazz says, I don't have any sexual sensation. I don't have any orgasm. This is because puberty was stopped at this stage and never allowed to go forward. Okay. How young of an age are we talking about? For puberty blockers, you can listen here to Ilana Scherer of UCSF Pediatrics.
As far as starting blockers, generally blockers are started at the first signs of puberty. It often can start like as early as like 8 at times or 9. And so those are kids who are going to be like in 3rd or 4th grade.
So in case you didn't hear, 8 or 9 years old, 3rd or 4th grade, and think of what you were doing or your kids at age 8, maybe building a snowman, maybe talking to snowmen, maybe thinking you were a cat or a fairy, something like that. Do we really know that the girl thinks he's a boy? Is really that the case? Is this the appropriate time to be starting these medications? More side effects, I went through some of them. You're going to disrupt the normal brain development that's happening with the sex-based hormones. It actually disrupts normal bone development because the sex hormones are important, so osteoporosis is a future risk. There are also neuropsychological effects. You can go yourself and look up the side effects of, say, Lupron. You'll see emotional lability, nervousness, anxiety, delusions. It even says monitor for development of worsening of psychiatric symptoms. Use with cautions in patients with a history of psychiatric illness. I've already said many of these adolescents have neuropsychiatric conditions. Professor Michael Biggs at Oxford, through Freedom of Information Act, found out what was going on in their Tavistock clinic. Children actually reported greater self-harm with this medication. Girls exhibited more behavioral and emotional problems, greater dissatisfaction with their bodies. Now you would think, if you had these side effects of these medications, wouldn't you want to stop? Well, eventually they do stop, but they found that the limited studies they have, 100% end up going on, up to 100% going on to cross-sex hormones, which is the next. So cross-sex hormones or opposite-sex hormones, which are really wrong-sex hormones, will be the next stage. So if a female would be given testosterone. Just to give you an idea how high these doses are, normal adult female will have a certain amount of testosterone, say in the range of 10 to 50. Medical conditions can bring this up to 150. Tumors may make this as high as 1,000. They're recommending to get these levels in the 300 to 1,000 range. This is some 10 to 40 times higher than the normal range. And are there side effects from this? Of course there are. Both sexes have shown increased risk of myocardial infarction, death due to cardiovascular disease. That's males taking this estrogen, females taking testosterone. With the male, 5 times increased risk of deadly blood clots, 2 times increased risk of stroke. Females also been shown with liver dysfunction, hypertension, potential for cancer of the ovaries or breast. I want to make this clear. There's no FDA approval for either of these medications for this use. And even at the UCSF pediatric site, it explains there, that's highlighted, that there is no FDA approval for this, but they're looking to get it through doing experiments. Here's another example. So the next stage is surgical conversion therapy. This is a female who had a mastectomy, and you can see the drain tubes there. People have said, isn't this a male, Dr. Laidlaw? And I'm looking at the male pattern abdominal hair and the 5 o'clock shadow. These are the direct results of high-dose testosterone. This is from a publication. Dr. Johanna Olsen-Kennedy is doing a 5-year, $5.7 million got a grant for research to study these hormones. One of the publications shows mastectomies done on girls. And you can see there is a couple of 13-year-old girls having mastectomies of completely healthy breasts, 14, there's 5, and so forth. Now, can a person of 13 or 14 consent? Do they know what really that they want breasts later on in life? Can they get them back again? Let's hear what Dr. Olsen-Kennedy has to say about that.
So what we do know is that adolescents actually have the capacity to make a reasoned, logical decision. And here's the other thing about chest surgery. If you want breasts at a later point in your life, you can go and get them.
If you caught that, she said, if you want breasts later in life, you can just go and get them. Is that correct? Can you just get a new organ, mail order it, have surgeons put it in? You cannot. Just another, so for Jazz, and the question, well, why were this complications of surgeries that Elaine talked about? Well, if you stop puberty at Tanner stage 2, as you can see, the penis length is very small, so they can't use the full length of an adult penis to make the pseudovagina. On the right, it just shows a section of colon or large intestine being put into place to make this false vagina. So that's why this is happening as a direct result of puberty blockers. So what's the bottom line on this child-adolescent affirmative therapy? We don't know long-term outcomes. I've told you already some short-term problems, but it hasn't been tested from childhood forward. Medications are being used off-label without proper FDA risk assessment profile. The quality of evidence, if you look at the Endocrine Society's own guidelines on this for children and adolescents, it says right in there, it's low to very low quality evidence. This whole thing is an experiment on children. We're ignoring the voices of desisters and people who have come out of this and recognize their sex. And the NIH is allowing unethical research to be conducted on children and adolescents, in my opinion. And so myself and colleagues used Freedom of Information Act to get more information about this research study, Johanna Olsen-Kennedy at Children's Hospital Los Angeles, and found that in 2017, they actually lowered the minimum age for cross-sex, wrong-sex hormones. It was 13. They lowered it down to 8 years old. So imagine giving 8-year-old girls testosterone. They're in 3rd or 4th grade. This is unbelievable, but this is going on, and you can see where I pulled the reference. Now the question is, how young is too young? Before they were giving cross-sex hormones at 16, and then it was 12. Now it's 8. And I look at this as an endocrinologist and say, there is another way to stop puberty if you don't want to use these medications. Just remove the testicles and the ovaries. You could do it at age 4, for example. Remove the gonads. How could a 4-year-old possibly consent to this? And I was accused of the slippery slope when I said that. But we're already down the slope. We're already down the slope. And who's going to stop this? Who will speak up for these children? And all of us need to speak up. Thank you.